Bienvenue à l'hôpital de Montréal pour enfants pour la première instance de porte ouverte pour la recherche sur le cancer de l'enfant. Welcome to the first open house for kids cancer research. We are having this event in September because it's Childhood Cancer Awareness Month, mois de sensibilisation au cancer chez l'enfant. Go Gold, Septembre en or. So I was asked here to speak about my journey and the research I participated in. I'm Zoe Morinville. I'm 15 years old. And in May 2017, I was diagnosed with high-risk B-cell acute lymphomic leukemia. Over my journey, I was asked to participate in multiple clinical studies, like a study for pain, a genetic defect study, and a study to see the best treatment plan for future patients. I think if someone asked me why I participated in studies, I would say that I benefited from studies that were done in the past, and I think it's important to pay it forward for future patients. I also think that it's important to participate in studies so people can learn about whatever you're doing the study on. I finished treatments last week thanks to all the studies that have been done, and I hope that in the future it'll be even easier for people to finish treatment because more and more studies will be done. Thank you. Merci.
Bonjour, je suis Stéphanie Badour, la gestionnaire de l'unité de recherche clinique de l'Hôpital de Montréal pour enfants du département d'hématologie oncologie. Merci d'être ici en grand nombre. Je vais présenter en anglais aujourd'hui parce que mon français n'est pas optimal, comme vous pouvez le constater. Par contre, si vous donnez votre courriel à nos bénévoles, nous vous enverrons toutes les présentations en français. Je vous présente Emma Anillo. Elle est coordinatrice de recherche et elle va présenter certaines sections en français. One note before we begin, Dr. Kolya Eppert was supposed to present on his leukemia stem cell research, and he unfortunately had a family emergency and cannot present today, but we hope that next year he'll be able to present as well. So we're starting out with this graph. And what does this graph say? This graph illustrates the impact of research on childhood cancer survival between the years 1975 and 2012. As you can see, the progress made is pretty spectacular. However, when you look more closely, you can see that some disease groups have made more progress than others. Acute myeloid leukemia, brain tumors, bone and soft tissue sarcomas, and neuroblastomas are still around 80% or under survival mark, despite the years of research. And we know that anything under 100% is not good enough for any child or family. So we continue to look for better ways to treat all of these cancers, decrease side effects and late effects of treatment, as well as improve quality of life of the patients. The overall survival for all childhood cancers is around 84 to 85%, and over 90% in some leukemia groups. However, there are still types of childhood cancer that fare very poorly, like a type of brain tumor called DIPG, which still has less than 5% survival rate. And despite cancer in children being rare, it's still the leading cause of health-related death in children in the US and Canada. But because we've had more success in treating childhood cancers, there are now a lot of survivors who require specialized care and treatment for side effects that show up during or after treatment, like hearing problems, heart problems, neurologic problems, reproductive problems, and other systemic problems. The other toll that surviving cancer can take is on the child's mental health and ability to work as they become young adults due to the late effects of treatment. Part of the research being done now focuses on these important long-term issues to try to improve survivor quality of life.
Donc ici, on voulait vous présenter où commence la recherche clinique. En fait, ça commence par des modèles animaux et cellulaires. C'est ce qu'on appelle la recherche préclinique. Une fois que les résultats ont démontré des résultats qui démontrent un potentiel thérapeutique pour nos patients, mais on va passer à la recherche clinique. Le but de la recherche clinique, c'est de déterminer quelle va être la dose qu'on va donner aux patients, vérifier le mécanisme d'action et surtout déterminer si le médicament est efficace et sécuritaire chez l'humain. Oh, that's me again.
Oh yeah.
Bien sûr, tout type de recherche est encadré par des instances réglementaires. Tous les projets qui sont réalisés avec des participants et ou du matériel biologique vont être approuvés et évalués par un comité d'éthique. Donc, le but, c'est de s'assurer que les données qui sont obtenues sont conformes et que les patients sont en sécurité.